Last year, a guy makes $50 million a year.
How many billionaires do you know that are making overtime or making any part of the
$235 billion. Look, it's a big bill. There are a lot of provisions in it. But as President Trump and you should know exactly where we are today, paying by far the highest prices in the world for prescription drugs.
Have you ever wondered why the richest country in the world has millions of citizens who can't afford to go to the doctor? Why prescription drug prices are higher here than anywhere else on Earth? In this fiery exchange, Senator Bernie Sanders puts Robert F. Kennedy Jr. on the hot seat, grilling him over the brutal truth about America's broken healthcare system. What follows is a masterclass in political accountability. So sit back, because this is one showdown you don't want to miss. Today, we're diving into a tense and revealing exchange between Senator Bernie Sanders and HHS Secretary Robert F. Kennedy Jr. Sanders doesn't pull punches, especially when it comes to healthcare. He calls out the systemic failures, the greed of insurance and pharmaceutical giants, and the fact that the US spends more money than any other country on healthcare, yet still leaves tens of millions uninsured or underinsured. As always, we'll unpack the full context, the key arguments, and what this means for everyday Americans like you and me. Let's get started. In a sharp and focused statement, Senator Sanders begins by quoting RFK Jr. himself, who acknowledges that the US is the sickest developed nation, while spending a jaw-dropping $4.5 trillion annually on healthcare, 2 to 3 times more per capita than comparable countries.
Mr. Secretary, thanks for being with us. Let me begin by quoting a sentence that came from your prepared remarks. You state, and I quote, "The United States remains the sickest developed nation, and we spend $4.5 trillion annually on healthcare, 2 to 3 times more per capita than comparable nations. Clearly, something is structurally wrong with our approach," end of quote. You're right. The current healthcare system is broken. It is wildly expensive. It is dysfunctional. So what do we do, Mr. Secretary, to address it? Maybe for a start, we do what every other major country on earth does and recognize that healthcare is a human right guaranteed to every man, woman, and child. Maybe we understand that the function of a rational healthcare system is not to make hundreds of billions of dollars in profit for insurance companies and drug companies who often engage in stock buybacks, pay their CEOs outrageous compensation packages. There was a guy from one of the major drug companies sitting exactly where you are sitting. Last year, a guy makes $50 million a year. Meanwhile, we don't have enough doctors, we don't have enough nurses, we don't have enough dentists, we don't have enough pharmacists, we don't have enough healthcare workers in general. So, if you and President Trump are serious about significantly lowering the outrageous price of prescription drugs in this country, as I hope you are, I would very much appreciate both of you working with me and other people on this committee and in the Senate. So if we are serious about that, let's work together and let's make that happen.
The speaker criticizes the US healthcare system as the most expensive yet least effective among developed nations, spending $4.5 trillion annually. They argue that healthcare should be a human right, not a profit-making industry for insurance and pharmaceutical companies. While CEOs earn millions, there's a shortage of essential healthcare workers. The speaker urges collaboration with officials, including President Trump, to lower prescription drug prices and fix the broken system.
Thirdly, Secretary Kennedy, all of us want to make the government more efficient and cost-effective, and few would deny that there is too much bureaucracy. But let me tell you also what we want and what the American people want. And that is, we want the federal government to play a major role in continuing its efforts to combat such terrible diseases as cancer, Alzheimer's, diabetes, heart disease, and other terrible illnesses that claim the lives of millions of Americans. In that regard, I must tell you that I have heard from citizens, patients, and doctors in Vermont and all over this country who are deeply concerned that under the leadership of you and Mr. Musk, the Trump administration has terminated at least $13.5 billion in healthcare funding, including more than 1,600 grants to conduct vital research into cancer prevention, Alzheimer's, diabetes, and cardiovascular disease, among many other medical research investments. Mr. Musk is 100% wrong. According to independent researchers, nearly 200,000 people have already died throughout the world as a result of the massive cuts in funding to prevent malaria, tuberculosis, HIV, malnutrition, and other serious diseases. Further, as a result of the elimination of U.S. funding for a global vaccine program, it has been estimated that over 1 million children will die because of the cuts that will save taxpayers very, very little money. So let me just conclude by saying this. The United States of America is the wealthiest country on earth. We should have the best healthcare system in the world, not one of the worst. Given our purchasing power, we should be paying the lowest prices on earth for prescription drugs, not the highest. Instead of giving hundreds of billions of dollars in tax breaks to the richest people in this country, we should be proudly investing in coming up with cures for cancer, Alzheimer's disease, diabetes, and other terrible illnesses.
The speaker emphasizes the need for a more efficient government, but strongly opposes major healthcare funding cuts made under Secretary Kennedy and Mr. Musk's leadership. These cuts, totaling $13.5 billion, halted critical research into diseases like cancer, Alzheimer's, and diabetes. The speaker cites that such actions have already led to nearly 200,000 global deaths and could result in over 1 million more due to reduced vaccine access. They argue that as the richest nation, the US should lead in affordable healthcare and medical research, not give tax breaks to the wealthy while slashing life-saving programs.
Let me ask you this as Secretary of HHS. We have in America today some 85 million Americans who are uninsured or underinsured. We spend more per capita, as you've indicated, than any other country. Is healthcare a human right? Are we making America healthy when so many people cannot afford to go to a doctor, when 68,000 people a year die because they don't get to a doctor when they should? Is healthcare a human right? Will you work with us to guarantee healthcare to every man, woman, and child in America?
Well, I think you're asking two different questions. You're asking a philosophical question about whether it is a human right, like a constitutional right. As an attorney, I would say that it's not a right of a kind that we otherwise enshrine in the Constitution, because healthcare costs your neighbor money. If I smoke cigarettes for 20 years, I make that choice, which is my choice.
I don't mean to, I don't have a lot of time, so I am here.
If you're asking me a philosophical question, I gotta, give you a thoughtful answer.
Within 30 seconds.
Yeah.
It's a problem.
So, it's not like freedom of speech, which costs, every.
But every other country, Mr. Secretary, every other country guarantees health care to all people as a right. Should we, as Americans?
The objective is to get Americans the level of health care that they want, the choice, which Americans want. Americans
They don't want the choice to be uninsured.
Well, but
They don't want the choice to die because they don't get to a doctor on time.
Americans prefer private insurance to other insurance sources.
Do you believe? Okay.
And what I would say is, I want to find a solution to this. I want every American to have insurance. President Trump wants every American to be insured and have access to health care. The question is, how do we get there? Obamacare is not working. It is not working. And this is the... Sorry to interrupt you. All right. The reconciliation... My job is to try to make it work.
All right. I have limited time. The reconciliation bill that is now being worked on in the House will come to the Senate. As it stands right now, cuts Medicaid in the Affordable Care Act by more than $715 billion which the CBO has estimated would eliminate health insurance for 13.7 million Americans, and also raise co-payments for millions of others, is throwing 13 million Americans off of the health care they have, poor and working class people, keeping America healthy.
A senator challenges the HHS secretary on America's failing healthcare system, citing 85 million uninsured or underinsured citizens and 68,000 annual deaths from lack of care. He asks if healthcare is a human right. The secretary avoids a direct answer, saying it's not a constitutional right, but agrees all Americans should have access. The senator criticizes proposed Medicaid cuts that would strip coverage from 13.7 million people, arguing this hurts the poor and working class. He urges the government to prioritize people over profits.
Well, I haven't seen that number. I've seen the number 8 million. And here the people, the cuts are not true cuts. The cuts are eliminations of waste, abuse, and fraud. And I can go through. I can go through the people who will lose it. There are a million people,
I really don't mean to be rude, but as you know, I have a very limited amount of time.
You ask the question, I'm going to answer it.
Well, yeah, I've got a bunch of questions that I would like you to answer as well. All right, we talk about austerity, doing more with less, but in that very same bill that is being worked on in the House right now, there are $235 billion in tax breaks for the top 0.2%. Do you think that makes sense when that same bill would throw 13 million people off of Medicaid? Should we give tax breaks to billionaires and throw kids and others off of Medicaid?
You're conflating the congressional bills with proposals from the president. The president
No, I'm talking about the congressional bill. I'm talking about the bill, the reconciliation bill.
I mean, the president is not trying to do tax cuts for billionaires. He's trying to have no tax on tips and no tax for
$235 billion by
how many billionaires do you know that are making overtime or making any part of the
$235 billion. Look, it's a big bill. There are a lot of provisions in it, but you cannot deny the top 0.2% will get $235 billion in tax breaks while we cut Medicaid.
A senator confronts the HHS secretary about a bill that slashes Medicaid while giving $235 billion in tax breaks to the top 0.2%. The secretary argues the cuts target waste and fraud, not vital services. The senator pushes back, calling it unacceptable to favor billionaires over struggling families. He questions a system that throws 13 million off healthcare while rewarding the ultra-rich. The clash reveals a broken approach that puts profits above people. In the end, the senator demands a future where healthcare is a right, not a privilege for the wealthy. So that's all. Thank you, and don't forget to like, subscribe, and press the bell icon. See you in the next one.